Good evening, everyone. Please be standing for the prayers.
Legacy. What is left behind when people move on or part? With the sudden and tragic sadness of the loss of Councillor Black, my mind was turned to what is a legacy. Legacies that impact, and as a result, you as councillors have a huge impact into the life and well-being of the community that we are part of. In the Bible, Jesus talks about legacy with the grain of mustard seed, with the story of the good vine, and with the story of the grain of wheat, where it grows and flourishes and impacts far more than anything else. You will have memories of the impact that you have had in your local community and the people that you represent. And as such, that has a wider impact, not only in this chamber here, but in the lives of individual people that you represent. And it is a powerful thing to be left a legacy. And you, as councillors, have that joy, privilege, honour of leaving an impact that will change, transform, challenge lives across this area in which we live. So make the most of it and recognise that when you're not here anymore, that legacy will remain. Moment of prayer. Father God, we come as a gathered community of representatives of this community. And we ask that your presence will be felt in this place and across the borough, in all the things that are decided here, in this gathering, in this chamber this evening. Be with each individual who stands and speaks, and may they know that they speak with clarity that will have an impact on lives beyond this dwelling. We bring before you the family especially of Councillor Black, and we mourn the loss of his life and the impact that he had in this council chamber and with those who lived in his constituency. Be especially close to his wife, Eleanor, and his son, Alex, in this time of loss and grief. And God of hope, we come to you in shock and grief and confusion of heart and ask that you will draw and send your peace to each and every one who has been affected by this sudden loss. Be with each and every one here that is represented this day. In the name of Christ, amen. And as we remain standing, we will have a minute's silence in memory of Councillor Black. Thank you, councillors.
Thank you. Before we go on, I would like to say on a personal front that I was very saddened at the loss of Councillor Black. He was an honourable man. He worked extremely hard for this council and for the residents. And he will be a loss to this council. So I just wanted to put that and say that tonight. We start the meeting. Item 1, apologies for absence. I have Councillor Mrs Mason, Councillor John Mason, Councillor Oldham, Councillor Mrs Shaw, Councillor Wilson and Councillor Toby Mountain. Are there any others? No. Item 2, minutes of the meeting held on the 18th of July. Do we agree those? Item 3, to receive declarations of interest. Hands going up. Councillor Rowe.
Thank you, Chairman. A non-pecuniary interest, please, on item 9. I'm a manager of one of the contractors and I do hold a licence. Thank you.
Councillor.
Thank you, Chairman. Item 9, a non-pecuniary interest as a licensed Hackney carriage driver.
Councillor Webb.
Thank you, Chairman. In item 5, a non-pecuniary interest. In item 4, as I'm a hospital governor. Thank you.
Sorry.
Thank you, Chairman. Yes, a non-pecuniary interest in item 9 with regard to being a licensed taxi driver.
Yeah, number 9, non-peculiar interest, being a licensed taxi driver.
Thank you. Oh, sorry, Councillor Cutmore.
Item 4, I'm a governor at Southend University Hospital Foundation Trust. I sit on the West Essex Clinical Commissioning Group on behalf of Essex County Council. I also chair the local Health and Wellbeing Board for Castle Point and Rochford. I also sit on behalf of the southern districts of the county on the Essex Health and Wellbeing Board as well. Thank you.
Thank you, Councillor Cutmore. Oh, Councillor Burton.
Thank you. Non-pecuniary interest in item 14 as a member of Rayleigh Town Council. I know that will be noted, but...
Thank you. Any others? Thank you. Right. Item 4, update on the Mid and South Essex success regime. Councillor Webb.
Invite them forward first.
All right.
Sorry.
Okay.
Madam Chairman, I'd just like to raise a point of order, if I may, please, before the presentation.
Sorry?
I'd just like to raise a point of order, if I may, before the presentation.
Yes, carry on.
At our council meeting in June, Rochford District Council requested that the NHS, and specifically Dr Caroline Howard, be invited to attend a future meeting of council to provide an update on the success regime prior to the end of the public consultation period in December 2017. This information was passed on to the CCG in both July and September. However, Dr Howard was not asked to speak. As portfolio holder earlier this month, I specifically requested that Dr Howard speak at full council tonight, and the CCG were again reminded of the council request. The response that I was given was that as to why Dr Howard is not attending is that the most relevant and senior representative of the hospitals is Dr Celia Skinner as Chief Medical Officer for all 3 hospital trusts. As Chief Medical Officer, Dr Skinner has the complete overview and the most comprehensive knowledge of the forthcoming proposals for public consultation. Dr Skinner will be able to provide the most accurate and up-to-date information, and she is also very keen to attend in person to hear the views of your members. I feel that it is a mark of disrespect to this council that our wishes to hear Dr Howard speak were not upheld despite repeated requests to do so. Why does this matter? Because as council members we want to hear from all sides of the debate, not just from the management but from the frontline clinical staff as well. From those that work in an A&E, in the stroke department and in the acute medical setting. When we discussed the A&E proposals, which were thankfully subsequently changed as they were shown to be flawed and clinically unsound, we were only told of the clinical concerns because Dr Howard was allowed to speak and gave us the viewpoint from a Southend-based clinician. Without this intervention, would the plans have been changed? Tonight, Dr Howard is sitting at the back of the room, unable to contribute to the debate, despite the best efforts of our council. Madam Chairman, in my hand I hold the results of the bullying and harassment survey from across Southend, Basildon and Broomfield hospitals. It states that between 24% and 27% of staff surveyed suffered from bullying and harassment in the last 12 months. And I quote, "It appears that the vast majority of bullying and harassment is perpetrated by managers and colleagues." Can I suggest that this may extend to preventing staff speaking as well? Madam Chairman, I would ask therefore that we suggest postponing the presentation until we can hear from both sides of the debate as originally requested. Thank you.
Dr Skinner, have you got anything to say to answer that? Yes, please.
Thank you, Madam Chairman. Councillor Colley does give an accurate reflection of the conversations that have been going on since Dr Howard attended your council meeting earlier in the year. I am here as the Chief Medical Officer with responsibility for getting the 3 hospitals to work in a different way, in a collaborative way, as we try to respond to the changing needs of the populations, the changing healthcare needs and the changing workforce that we are all facing. And our bottom line here is that we want to improve the quality of care, the safety of our services and the sustainability of our services. Because of my role, I'm able to look across the whole of the changes that we're trying to make across the hospitals, and also have a greater insight into the changes, the important changes that our colleagues in primary care and through the CCGs are trying to make as well, because clearly it's the whole of the health service coming together is going to provide a better outcome. We are not trying to gag clinicians, nurses, doctors from speaking, and in all our development of proposals we have a process where we share what we are discussing, we involve clinicians at every stage, and then we take it back out to our clinical teams to say, have we got this right? Do we need to make changes? What refinement is needed? And we continue to do that process. And clearly we are about to go into, we hope, a period of public consultation, which will run for 12 to 14 weeks, which then not only gives the opportunity for the public and yourselves to comment on the proposals, but also the staff, who are clearly important stakeholders in this process. We're not at that process of public consultation yet. We're trying to get to a point where we've got what we think are a reasonable set of proposals that we can take to the consultation.
Thank you for that, Dr Skinner. I am concerned that the resolution was passed at the last meeting to invite Dr Howard and yourselves to come along, and Dr Howard is not being allowed to speak. However, the resolution was to invite, and we have done that, and I wouldn't wish to give you the discourtesy of you've come along tonight and we would like to hear your presentation. However, I would like to stress that any future invitation to Dr Howard or any other clinician wouldn't be blocked. We would like to hear both sides of it, but we would like to hear your presentation tonight, if that's... yes.
Excuse me, Chairman. I think perhaps...
Chairman, Councillor Hoy was first. Put his hand up to speak before. I do apologise.
Okay.
I'm happy for... sorry, for my fellow councillors to ask the question first.
Thank you.
Perhaps maybe this should be put to the vote of the councillors in the chamber as to whether they wish this to continue. Thank you.
Councillor Hoy. Sorry, I didn't see you.
That's your Vice Chairman did, but obviously the note didn't get passed. That's fine. Actually, I think it was virtually the same question. All I was going to say, what I was also suggest to Councillor Webb was, did he want to make that a formal motion or not? Thank you.
I would very much like to hear Dr. Howard speak this evening. I would be happy to make that as a motion, but Madam Chairman, it's up to you to decide whether you'd like to invite our guests to speak first. But I would like to hear from Dr. Howard this evening as well, please.
I'm sure it's within the rights of the Chairman to vote who they want to speak, even if it means suspending standing orders for the period that invitation stands for. Sorry, my mic wasn't on.
No, I think we could all hear you, Councillor Hoy.
So invite her to do the presentation, that's what you want, Chairman. Yeah, okay.
I would like to hear from Dr. Skinner, so that we can hear at least hear this side of the presentation at the moment. Thank you. It's not a motion. It's not a motion. It's not a motion.
It wasn't a motion. It wasn't a motion.
It wasn't a motion, no. So,
Okay, so you invite Dr. Skinner.
Dr. Skinner, could you give your presentation, please?
Thank you, Madam Chairman. So I'm supported by Tom Abel, who is the Chief Transformation Officer for the 3 hospitals, and Ian Stickson, who I'm sure is known to you as the Accountable Officer for the 2 local CCGs. So I've just got 8 brief slides, and then there's clearly the opportunity for you to ask questions. Thank you. So, as I say, this is this is an update of where we've got to in this process, and just trying to describe some change to the hospital services and also to the outer hospital services. And this is about genuinely trying to improve the safety of our services, the quality and the sustainability. And sustainability isn't just about money; it's about a sustainable workforce. And I'm sure you're all very familiar from the national press and your local press in the difficulties in filling many posts, be they nursing, medical, allied health professionals in healthcare. So I'm going to update where we are with the 3 hospitals. You know, we obviously are talking about Southend, and it's important that's in the context of Basildon and Mid-Essex as well. Look at these proposals within the overall context from where our plan was first published in October 2016, and explain to you how this does fit within a national framework. We're not, we are governed as you are. We have many people we have to answer, many checkpoints we have to go through to make sure that the things that we are suggesting and consulting on are safe and in the best interests of our patients and staff. So what we're trying to describe is a plan, a system plan. It's not just about the hospitals, it's about the whole healthcare system. So GPs, community providers, everybody who contributes to the health and well-being of our staff. And the basic premise of that is that we want to support people to live well, so the sort of healthy living agenda. We want to invest and develop local services. We know that is the right thing to do, but also we have a responsibility to try and improve the care that we deliver within the hospitals. We know there are examples of excellence already across the 3 hospitals, but we know that equally there are things that we need to do better. And we equally recognise that by working together in collaboration, we're more likely to make those improvements. And what we're describing for this part of the country is being replicated across the other 44 STPs and is being replicated internationally. All health systems are having to respond to the big health changes of ageing populations with complex health needs, the opportunities that technology is beginning to present to us now and how we should deliver health in a different way, and the need to look differently in terms of how staff provide care towards patients. So, as you are well aware, we came with some proposals which were at proposal stage earlier in the year around beginning to think how could we reconfigure the hospital services differently. And we listened at that point, and clearly we received from very strong feedback from many different people that what we had people were uncomfortable with. So on the left-hand side of this slide, you can see there was a strong desire that we maintain 24/7 consultant-led emergency departments at each of the 3 hospitals, that we should continue with paediatric and maternity presence at all 3 sites. We have always said that. We have never said we are going to change that. That remains in the proposals that we wish to get to consult on. That we didn't want, the message we heard and we agree with, is that we want older people and children, where possible, should be receiving their care locally. We don't want people travelling unnecessarily around our 3 hospitals, unless they can only get that complex care in one particular place. And we also heard very clearly the uncomfortableness that people articulate around ambulances bypassing their local hospital. And we've listened to that and we've modified our proposals consequently. And as we already recognise, both within the hospital setting and importantly within the ambulance service, we know the ambulance services don't have the resource to do a bypass and a big transfer system. We absolutely recognise that would require investment. So, what we have come up with is the development of a treat and transfer model with local hospital transport if we do need to move patients around the system. And I can provide some more detail on that if that's necessary. And in fact, Dr. Howard was one of the architects of that change. We want to describe, as we always have, that Southend is the cancer service, cancer centre for your local population and the local populations of Basildon and Mid-Essex. But to support that and augment that, we maintain 24/7 consultant-led emergency services at Southend. There will be at times probably a need for limited ambulance bypass. It already happens. If the paramedics make a diagnosis of a heart attack, they have conversations and that patient will go straight to the cardiac centre at Basildon, where we have nationally recognised excellent outcomes. The same will happen if a patient needs complex burns treatment. They may well go straight to the burns centre at Mid-Essex. It's an accepted method of working. As I said again, we want the frail elderly ideally to be treated in their locality, through their GP practice, through their community nursing team. But if they do need to attend the hospital, it should be their own local hospital. The same for paediatrics. Same for our children. Can we treat them locally where that is possible? And as I said as well, keep the obstetric care. We've got big obstetric units. Keep those where they are at the moment. But we want our teams to work together. So, 24/7 consultant-led emergency departments at all 3 hospitals. Importantly, and I'll show you this in a graphic, supported by assessment units. All 3 hospitals continue to do blood tests, x-rays, outpatients, day case surgery, as is now. And that actually is the bulk of visits to a hospital. It's not patients being admitted, it's people attending for something. All of that continues to be delivered locally. Continuing the maternity services, but recognising, and the research evidence, this isn't us coming up with this as an idea, that in certain complex conditions, low volume, complex things, it's better to bring those things together. It's better to create those teams who have specialised in these areas with the right kit, and probably for our population it's better to do that once well rather than 3 times in a fragmented piecemeal approach. So this may not work, and we'll test this graphic if it's not working at the moment, but essentially if you come to hospital you come through 3 routes: through ambulance, as a walk-in, or through your GP. And what we're trying to do at the front of each hospital is begin to change the way we don't want people bottlenecked through the hospital, through the ED department. We know that can be a poor experience for patients and staff. We begin to separate out people a bit. So there will be emergency hub, so that's the emergency department, alongside some GPs, alongside some specialists in medicine, surgery, older people medicine, paediatrics, who can assist the emergency department in recognising that there are people with specific needs and offer the right treatments. And we want all of that at each of the front doors, metaphorically, for the 3 hospitals. And at that point, we may identify a small number of patients who would benefit from transfer. If we can treat people in that first early period, or through the ambulatory care setting, where someone perhaps doesn't need to be in a hospital bed but needs urgent tests, that's what we want to do. We make sure we've got the right X-ray resource, specialist opinion resource, fast blood tests, whatever it is that we can turn around and give somebody an early diagnosis and not have to admit them to a bed for a series of things to happen. And we're trying to enhance that across all 3 sites. And if people do need to be admitted, the vast majority of patients will be admitted locally, as they are now. There will be a minority where we say, actually, we think it's better, we've consolidated some of this experience in a different setting, and you're going to get a better outcome, a small part of your care, by going there. We don't own this process, the acute hospitals. It's Ian's colleagues across the 5 CCGs who own this process. And they're working together in a joint committee to help us get to the point of public consultation. The public consultation, hopefully, adds to the proposals that we put forward, makes them stronger, makes them better, makes them sit with what is will improve health outcomes. But it's the CCGs then to say, okay, we get with this, let's try and implement those changes. And those changes will take years to implement. This isn't something that's going to be happening in April 18. And decisions will only be made in 2018, and we have bid nationally for investment, limited investment, to try and make these changes possible. We've yet to hear the outcome of that. And anything we do will obviously have to have fully worked up plans, sensible, logical ways in which to implement. And at the heart of that, test that with the doctors and the nurses to think this is going to improve on what we currently do. So we're in a series of dates and meetings, and all this timescale is set externally. This is set through NHS England. This isn't at our behest. And it's certainly true that over the summer we've had to accelerate things. That was outside of our control. But we work within a wider framework. So we're now at the point of trying to go back to the investment committee. Can we get some additional investment to the system? And that will hopefully provide the green light that we get to public consultation in November. And it'll be a long period of consultation, reflecting that probably will run over the Christmas period. So it will be extended to facilitate that. Tom, is there anything you want to add at this point?
No, I think the only thing that I would want to add to the process is clearly we're not in a position yet where we have a firm set of definitive proposals around exactly how each of the clinical services would operate, and that is something that we will have in the coming weeks once we've gone through this assurance process and the work with the clinical senate. and that we're more than happy to bring those more detailed proposals back. And indeed, we're more than happy to bring the clinical leads from across our 3 hospitals to talk to you about what they mean. And so, looking at how what the evidence base is around bringing together certain low-volume specialties, as Celia has described. So we're not in that place at the moment, and we will be in that place hopefully next month once we get through the assurance process. So this is really just an update in terms of where we're at in that kind of process that we're having to go through with colleagues, and the change that we've made following the conversation that we had when we last met with you, when we last met with others, around taking any kind of major change to the 3 accident and emergency departments at the 3 hospitals off the table. So no decisions have been made yet. I think that's the most important thing. The consultation will be exactly that, a consultation, and we anticipate that our clinical model and the details of how that work will need to change and refine as we listen to local communities, and indeed we listen to the entire clinical body from across the 3 hospitals. We employ somewhere in the region of about 17,000 staff across the 3 hospitals, so it has not been possible to engage everybody in that process yet, and we want to be able to do that over the course of this 14-week period. So I anticipate things will change. We are more than happy to come back once we've got the more detail around exactly how the clinical model will work. We're more than happy to bring our clinicians who have led and thought through the individual service changes at an individual specialty level. But we're very, very conscious that we wanted to give you an update following the last meeting, particularly around this issue on A&E and ambulance bypass that we know was of such significant concern to you. And so we could tell you face to face that actually we were taking those proposals off the table following the feedback that you provided us. However, there's still more work to be done, there's still more engagement to be done, and we are a long, long way away before making a final decision, which, you know, as on that slide, it would not be until March 2018. So there's still a lot more time to engage, discuss, debate, refine, and that's what we are committed to doing. And I hope, actually, given the decision around A&E and ambulance services, has shown that actually we are willing to listen and we are willing to change where there are major concerns about any of the proposals. Thank you.
So just from a CCG perspective, just to say that we have to work as a system. We know that we've got unprecedented demand that's coming into our hospitals, into our out-of-hospital care, and that demand continues to increase. The case for change, in terms of what we need to do, has been made. We know we have to change, and that is never easy, but as a system, we've recognised that we need to make changes. You can't do this alone, and Celia's alluded to the out-of-hospital care, and there is just as much important that we get the out-of-hospital care, the provision, that actually we can do more, and we mentioned this last time when we met with you, within our localities to actually recreate or create an environment that is safer, more appropriate, and easier for patients to access. We have to look at that in its totality. We have to ensure engagement is happening between clinicians and clinicians. That is happening. Only last week as a CCG, we had a really good meeting with some of the key consultants from Southend Hospital and our GPs to discuss some of this and take this forward, recognising that it's not formed yet. There's still a little way to go, and that things will change. But I hope that you will see that from the feedback we've already received, as Tom's alluded to, you know, we are listening. We're trying to hear what it is you're saying, what your concerns are, and looking to see how we address that. And we will continue to do that as we progress on this timeline.
Thank you.
Thank you. Councillor Webb.
About the proposals remain. As noted earlier, what we asked for was a debate, but I thought we've been given a very good sales pitch. I would very much like to hear from the clinicians who work in these specialities and to take you up on the offer of clinicians coming here and actually speaking to us, please. In particular, I'd like to ask how staff have been consulted. I am concerned how much consultants for both Southend, Basildon and Broomfield who may be opposed to these changes, but are maybe being pushed into agreeing with the viewpoint that's being put forward. And perhaps a culture is emerging where senior clinicians are not able to air their own views, as has been evidenced this evening through Dr. Howard not being permitted to speak. The talk is of planning to recruit transfer teams to manage the transfer of patients, but I would ask how you're actually going to recruit transfer teams which will need anaesthetists, nurses, paramedics, when you're already struggling to recruit A&E staff and have gaps in other roles. What if there are 4 emergencies at once on site and staff are all out on transfers and have been left stranded at another hospital? Or if someone is transferred and they're not considered necessary for speciality admission and need to be transported home or to transferred back to the hospital? This will lead to multiple journeys and inconvenience, even more so if they're elderly or infirm. My key concern is based around the central theme of the clinical evidence around transferring patients and the evidence for some of the proposals that are coming forward. My concern is that this will not lead to a better outcome for the patients than they get now. I remain concerned that at heart this is a cost-saving exercise that does not have increased patient outcomes at its heart. Madam Chairman, with these concerns in mind, I would like to put forward a motion that the Council has concerns about the impact that these proposals will have on our local residents and how they will improve patient outcomes, and remain concerned about the level of clinical input. Until we've been able to have a balanced debate and heard from frontline staff being allowed to speak freely, I do not feel able to support these proposed changes. Thank you.
Councillor Gooding.
Thank you, Madam Chair. I'd like to second the motion put forward by Councillor Webb and retain the right to speak at the end of the debate.
Thank you. Councillor High.
Does that mean the presentation is now no longer taking place? There are no questions now allowed, so we cannot.
We have a motion on the floor, so we need to be speaking to the motion. So I have you, Councillor High, down as the next speaker anyway.
I'm not speaking to the motion. I will not speak to it. I came for something else. I think the motion that should have been put was the one which Councillor Webb didn't put earlier. Thank you.
Councillor Ward.
Thank you, Madam Chairman. Yeah, I am on apparently. Thank you. I'm just a wee bit confused, and I'd just like some clarification, if I may, Madam Chairman, from those who have given this presentation. I believe that the 3 clinical leads, who would be Diane Sarkar, Celia Skinner, who is here this evening.
Please, Chairman. I was just told I wasn't able to ask questions of the people who made the presentation.
We are, actually, Councillor Ward, we are speaking to the motion. Thank you. Does anybody else want to speak to this? Councillor Steptoe?
No, I had a question.
Anyone want to speak to the motion?
Could I just speak to the motion, please, after all? Without being able to ask questions of the people who made the presentation tonight, I don't feel well enough informed from the information I have garnered myself, although that is quite substantial, to be able to judge properly whether I can support the motion or not. Perhaps Councillor Webb might like to answer the questions instead.
It was my understanding that the questions could be taken to the motion as well, Chairman.
Questions to the motion? Yes.
Yeah. And questions to the panel as well. No, I'm sorry. Once a motion has been put
moved and seconded, then we can only talk to the motion, and the councillors can only talk. So have we got anybody else want to speak on that? So do we want to vote on the motion? Perhaps you could make it a bit, repeat what it is again, please.
Yes, thank you, Madam Chairman. A motion that the Council has concerns about the impact these proposals will have on our local residents and how they will improve patient outcomes, and remain concerned about the level of clinical input. I feel until we have been able to have a balanced debate and heard from frontline staff being allowed to speak freely, I do not feel able to support these proposed changes.
And Councillor Gooding, did you want to sum up?
Just to say, Madam Chairman, that I too have these same concerns, and I'm really concerned that there isn't the clinical evidence that backs up what our residents would wish, and that is outcomes for them regarding these changes with the treat and transfer situation.
Thank you. Anybody else want to speak to this? No, so can we put it to the vote then? Those in favour of the motion? That is carried. Thank you.
Thank the attendees for attending.
Thank you, Dr. Skinner and Mr. Abel and Mr. Stidston. Thank you for your time.
It's item 5, Chairman.
Right. Item 5, which is announcements from the chairman, leader or head of paid service. There's just a couple of things I would like to say. This is Rob Manning's last meeting as our 151 officer, and I would like to say thank you very much for your input over the last however long year. Nearly 2 years. And welcome to Naomi Lucas, who's taking over as the 151 officer. I won't run through all the things I've been doing over the last few months, but I have represented this council on numerous occasions, both in the district, in Essex, and as far as in some parts of London. There's been some very interesting things that I've done. One in particular wasn't very grand, but I visited a local resident who has been doing good deeds in our district for about the last 50 years without any recognition, and it was really nice to meet her, and they're the sort of people that I'm really enjoying meeting. But I also helped give an award to the first company in our district to win the Business Standard Award, which was very good for our businesses in Rochford too. So I won't go through everything else, but rest assured I've been exceedingly busy and attending events weekends and during the week. So that's just from me. So I don't know, leader or head of paid service? No. Right. Item 6, public questions and members' questions on notice. There are none. Item 7, business from the last council meeting. There is none. Item 8, to note the minutes of executive and committee meetings held between the period of the 15th of July to the 6th of October, and they're listed. Councillor Hoy. Councillor Cutler.
Chairman, in noting those minutes, I'd just like it noted that on the 6th of September, on item 4 of those notice of executive decisions, there was a decision that the car parking charges in all council car parks be suspended on the Saturdays during December 17 prior to Christmas. The dates are the 2nd, the 9th, 16th and the 23rd of December 2017, because we have a motion, I think, coming up later, Chairman, that says exactly that same thing. Thank you.
Right, thank you.
Councillor Hawley wanted to say something.
Did you want to...
Thank you, Madam Chairman. Yeah, thank you, Councillor Cutmore. I did note that, and I'll speak about it later. The item I wanted to raise was item 6, the executive of the 6th of September. I have spoken to Mr Manning about this already. It's concerning the quarter 1 financial reports, and there was a comment I made where the to Mr Manning where the capital outruns on the IT migration project, the budget, and was not stated correctly, as I understand it. I think you're going to confirm that or not. Thank you.
Can you confirm it?
Thank you, Chair. Good evening, everyone. Yeah, I'd just like to confirm what Councillor Hoy has rightly pointed out to us. So in one of the capital tables, we incorrectly reported the IT migration project budget. Unfortunately, that was updated on the 23rd of May, but we didn't actually pick it up in the Q1 report. So that what that should say is the latest budget is around £642,000, and our outturn spend against that, as we are currently, or as we were in Q1, was around £598,000, which would give us a £44,000 underspend. So that is a correction. Thank you, Councillor Hoy. Thank you, Chair.
Thank you.
That's it, Chairman.
So, can we...
Item 9, Chair.
Item that. So, we now go on to item 9, to consider reports from the Executive and committees to Council. So, first one is Councillor Mrs Weston, please.
Thank you, Madam Chairman. Yes, we had a meeting on the Appeals Committee last week to amendments to the Hackney Carriage private hire driver operator licence conditions, and it's just proposed that ask the Council to resolve 1.4, if I may please, Madam Chairman.
Is that agreed? Agreed. Thank you. Right, Councillor Burton, please.
Thank you, Madam Chair. As detailed, the Review Committee undertook an annual review of the Council's RIPA policy on the 3rd of October. Whilst there are several changes that are proposed, these are relatively minor and mainly relate to amendments to Rochford District Council staff referred to in the Council's policy, and also to changes following the abolition of the existing regulatory bodies and the creation of the IPCO, who are now responsible for the judicial oversight of cover surveillance by public authorities throughout the UK. It's therefore the Review Committee's recommendation that Council accepts the updated RIPA policy as per the officer's report, with the inclusion of an additional statement referring to the use of young or vulnerable people. If any members have any questions, I'm sure that Louisa Moss would be happy to answer. Thank you very much.
Is that agreed, members?
Is that agreed, members? Agreed.
Sorry, Chairman, if I may, just sorry, in response, I've just spotted this on 9.38. It's been agreed to sign off, and I need to sign off on the officer's name. Patricia Christie is no longer an officer of this council, so therefore it'll be taken off that list on page 9.38.
Is that noted, members?
With that minor amendment.
Is that noted? Yeah. Right. Item 9.1, Councillor Cutmore, please.
Thank you, Chairman. Just to nominate Councillor Ianu as the portfolio holder of enterprise onto the Crouch Harbour Authority representing this council. Thank you, Chairman.
Is that agreed? Agreed. Item 10, report on urgent decisions. There are none. Item 11, report of the leader of the work of the executive. Councillor Cutmore.
Thank you, Chairman. Right, this is the second ordinary full council meeting of the 17-18 municipal year, and I would like to welcome all members. Since the meeting on the 18th of July, the Executive has met on 3 occasions, during which considerations have included the Financial Outturn 2016-17 Management Report and the Quarter 1 17-18 Financial Management and Performance Report. Also, recommendations from the Investment Board on its review of asset register sites and the Wyvern Phase 1 project. Other matters that my colleagues and I on the executive have dealt with include the approving of the Environmental Health Service Plan for 2017-18, amending the heads of terms of the Public Realm Agreement to incorporate the Essex County Council's Highway Ranger Service, and the recommendations to the Member Advisory Group on allocations of the second round of funding to local voluntary organisations. And finally, of submitting a formal response to the London Borough of Havering's Regulation 19 Publication Draft Local Plan consultation. Through you, Madam Chairman, as always, I would be happy to take any questions from members in respect of the work of the Executive, and I'm sure my Executive colleagues will be happy to contribute where appropriate. Thank you, Madam Chair.
Thank you, Councillor Cutmore. Are there any questions? Right, so now it's item 12, which is the motion on notice. Councillor Hoy.
Thank you very much, Madam Chairman. Obviously, Councillor Cutmore has pointed out this motion has essentially been agreed already. The motion was put forward by members of the group in July this year, and basically on the basis that the administration has acted on it already through the meeting of the Executive in September, as pointed out by Councillor Cutmore, I can confirm that the signatories of the motion are willing to, so I'm talking very quickly I think, are willing to withdraw it, and would like to thank the Executive for listening to us and acting so promptly on to our concerns. However, I'd just like confirmation, if possible, from the Section 151 officer that this has been costed and is affordable. Thank you.
Councillor Cutmore.
Chairman, if I can get this working, I don't think members of the Executive were aware this motion was coming forward before the Executive. It is something we've done every year since I can remember. I think it must be at least 10, 12 years now. So whilst I accept the motion that was put forward and the spirit in which it was given, I think it's a bit sort of superfluous really, in as much as it was something that was going to be considered in any event, pending the fact that obviously the finance is permitted, which we clearly thought they could be. So, you know, I think we're all, the point is we're in violent agreement, I think, about this motion as it stood. So I'm pleased that all sides of the House, as far as I can tell, are actually in support of this. Thank you, Chairman.
So, can I have a point of matter of fact, please, Chairman? At the Executive meeting on the 26th of July, the Managing Director did inform the Executive that there was a motion put forward in July. Thank you.
Can you just confirm?
Chairman, there's can be no debate or discussion because it's already been decided, Chairman. So.
We've got the finances.
Yeah, I'll just confirm that as reported at Q1, the Council is reporting an underspend of £91,000 projected for the end of the year, so there is sufficient resources within the MTRS to fund that decision. Yeah.
Thank you. And as everyone said, because this has already been agreed, it's not appropriate to debate this. Yeah, that's right. So thank you. And at least everybody from all sides is in agreement that our residents can have free parking in the 4 Saturdays running up to Christmas, which is good for them. So item 13. Mr. Scrutton.
Thank you, Chairman. The future of Essex, an interesting topic, perhaps. Much work has been carried out over a great number of months to produce a document, The Future of Essex. I have a copy here, and there is a black and white version of it appended to your agenda. Now, the purpose of The Future of Essex is to give all the many different communities, groups and businesses of Essex a way to collaborate in planning our future. Key messages are to set out the kind of Essex we want to live in, to transcend short-term agendas and move us towards the big things that matter to all of us and take pride in our county. Now, the vision recognises that because change is always coming, we want to make sure it's positive and that it happens on our terms. The vision sets out 7 long-term ambitions, and those are summarised in paragraph 3.4 of the report. The key message, the practical recommendation in the report going forward for the next period of time, next 6 months or so, are set out in paragraph 4.3. Partners being asked to promote the vision and engage with stakeholders, identify and build on existing pieces of work that exemplify the vision, begin new work to support the vision where appropriate, build system coherence by creating a golden thread that links the vision to other strategies, and to widen the system of leadership and invest in staff and organisational development. Now, the ambitions that are set out in the future of Essex, I think, in large measure, I would suspect members would not disagree with, and actually they do parallel some of the ambitions that are in the Council's own business plan and our recently adopted people plan. I think some members had a training session on the people plan very recently. So, Chairman, the recommendation is that Council resolves to endorse the vision and the ambition set out in the Future of Essex document. Thank you.
Councillor Cutmore.
Thank you, Chairman. I won't speak at length on this because I don't think there's anything in this that any member would object to, I'd like to think. Clearly, I think we do need a vision for Essex in as much as we are an entity. We are a collection of eclectic people, I think, in Essex. There are very different people in Essex from one end to the other, from north to the south. And I think largely this document sort of represents that as well. But we do need to make clear about what we're wanting for Essex, about how we want a future for Essex, and how we want to get the investment, the growth that we need to make sure Essex is an even better place than it is already to live in. It does have a unique character, Chairman, other than that popularised, I think, on the television, that I think some people can identify with, but many others can't. And I think Essex is a great place to live, to bring up your children, to work and to play. And I think some of this document certainly represents that, Chairman, and I look forward to endorsing it. Thank you.
Councillor Mr High.
Thank you, Madam Chairman. I think it's an interesting document. I don't think many people could disagree with the sentiments in it or the comments made. I think some of it is a bit ambiguous, some of it may be slightly contradictory, such as there's a bit of there I saw in there, Prison of the Commute, where it's talking about making better transport and links to London, as far as I could work out. But it may be transport links within Essex. So I think there's work to do on it still, which I understand is the point of this. I just do have a question. Would looking at this, it could have impacts upon our business plan to some extent of how we could rework it. Would we be looking to review our business plan in line with this as well? Thank you.
Well, Chairman, I think it's appropriate that we continue regularly to look at the business plan. So, I mean, I think the point is a well-made one, and what I would consider is that we'll look at the 7 ambitions that are included within the future of Essex and seek to show in reports and so on how we actually are reflecting those in the work that we're doing. I mean, the main principles, though, of our business plan, I think, are clearly set. So it would be more around the margins that we would look at opportunities to ensure that we're showing how we are going forward with the document.
Any further questions? So the recommendation is that the Council resolves to endorse the vision and ambition set out in the Future of Essex document. And so is that agreed? Item 14, Public Spaces Protection Order. Mr Houghton, please.
The report sets out public space protection orders. I can probably talk loud enough to be quite truthful. But, I think you'll find. That'd be enough. Okay, the report sets out to introduce public space protection orders under the Antisocial Behaviour, Crime and Police Act 2014. These in the main seek to replace the existing 2008 dog control orders that has been rescinded this November. And they also seek to address specific issues that have been identified through presentation of sufficient evidence of antisocial behaviour matters. Members may recall that a draft of the public space protection orders were circulated in the member bulletin in late August. These have been revised to reflect the orders that at present time are viewed to present sufficient evidence to satisfy the required conditions for their introduction. So basically say that we've removed certain orders that we feel that at this stage we have not enough evidence to sort of satisfy the evidential requirements of the Act, and therefore you have a pared down set of these at this stage. But I'm happy to take any questions on this matter.
Thank you, Chairman. I think a lot of residents will welcome this, particularly if you go by the Holdridge Facebook page, with regard to dogs, shall we say. There's lots of concerns. The only query I have, which I have raised with Marcus already actually, so just to give you more of it, was on page 14.8, where Holdridge Parish Council request that Parish Council employees are included as an authorised officer. Obviously, I think if you did include Parish Council employees as officers, it would give some bite to the power in that they could then enforce. However, it also gives me concern of how with their training and whether or not they're equipped to be able to enforce these rules. So it's just a concern about that, how if you looked at that, how you plan to deal with that, and where we'd be going forward. Thank you.
I mean, certainly, I think at a later stage we certainly intend to talk to the parishes about how they wish to see this implemented. You know, there may be advantages to having officers delegated, and I need to see how that works legally. I think I'd look to Andrew to give me some advice on that. But it is possible, but equally I'd be cautious about perhaps having parish sort of officers given these powers. But that's not so we won't consider it, but it will be considered at some time soon.
Thank you, Madam Chairman. Yes, just a question to Marcus. You're saying about some of the old orders that will no longer continue because of having to meet the new criteria. That sort of evidence of previous history, I presume that still be held on record just in case any further problems arise in those areas that may help add to possibly the implementation of anything in the future?
Records of antisocial behaviour complaints are kept on record regardless. So you know, this is not the be all and end of all the public space orders we may present. There may be ones in the future as well, but it does require the evidential base to be able to do so.
Chairman, I've just been looking at the report, and the report says in quite mundane and polite language what really actually has become a pretty desperate problem, not just for Rochford, but for many local authorities around the east of England. We simply cannot recruit experienced, qualified planning officers, and it's a real problem and issue, I think, for the planning service in Rochford. Hence the reason for bringing this report to you this evening. It's a straightforward amendment to the pay policy to allow the council some flexibility in the remuneration for planning officers that hopefully will give us an opportunity to compete better in the marketplace. Chairman, thank you.